Migraine patients often experience cognitive symptoms, especially during the premonitory headache and postpone phase of the migraine attack. The most common affected cognitive domains are the visuospatial abilities, executive and attentive functions. There is evidence that cognitive deficits in migraine patients might be associated to functional and structural alterations involving cognitive brain networks. Against this background, in our study, we aimed to investigate the performance of migraine patients during a visuospatial processing task and explore the neural correlates associated to visuospatial processing. So we recruited 17 patients with episodic migraine who were headache-free and 16 controls. All participants to the study underwent a functional MRI visuospatial processing task that included an angle and a color discrimination paradigm. The angle discrimination paradigm consisted in the discrimination of the angle included within the end of a clock, and the color paradigm that was used as a control task to highlight the visuospatial processing functions consisted of the discrimination of the color of the end of a clock. So what we found was that around 20% of patients experienced visuospatial processing deficits. However, during the functional MRI visuospatial task, all patients preserved and maintained a good performance. Regarding the imaging findings, we observed that compared to controls, migraine patients showed an increased activation of the insula and overfrontal areas during the visuospatial processing task, as well as a decreased activity of the most posterior region of the cingulate cortex. And the most interesting part was that the functional alterations were associated with a better performance in the angle task, so a better performance in the visual specific task associated with the visuospatial processing. So these findings suggested that plastic functional changes might occur in migraine patients during a visuospatial processing task. And interestingly, the regions that we observed were differently activated in migraine patients compared to control during visuospatial processing, were those regions that are commonly also activated and involved in pain modulation and pain processing. So our results might suggest that migraine patients activate or adopt some adaptive mechanisms that might be influenced by the activation of the same region that are usually involved during their attacks.